Welcome everyone to our webinar on Resources for Low-Income Older Adults, presented by the Fall Prevention Community of Practice. My name is Lindsay Toth and I am a project coordinator at the Ontario Neurotrauma Foundation. ONF sponsors LOOP and the Fall Prevention Community of Practice, or COP. Marguerite Thomas also joins us on the line. Marguerite is the coordinator of the Fall Prevention COP and will be assisting with the webinar technology. Before we begin, I'm going to give you a quick rundown on the Level 3 web meeting system. This webinar technology consists of two parts. The audio is provided through a telephone conference line. The visuals are provided through a web platform. The phone number for the conference line and the link for the web platform were sent to you by email after you registered for the webinar. If you have questions about the technology at any time during this presentation, please type them into the chat box located on the left-hand side of your screen. Alternatively, you can email lindsay@onf.org, and we will work with you to resolve technical issues as soon as possible. This webinar will contain an opportunity for participation. We will take questions throughout the presentation, so if you have topic-related questions, please just type them into the chat box whenever they come up. I will read those questions aloud to the presenter and the rest of the group. We will also have a Q&A period at the end. During this time, if you would prefer to ask your question over the phone, we will give you those instructions. I would now like to introduce our presenter for today, Faed Hendry. Faed is a Certified Information and Referral Specialist who is Manager of Training and Outreach with the Findhelp Information Services in Toronto. So Faed, you may now take it away, unmute your line, and whenever you're ready.
Thank you very much, Lindsay, and thanks to everyone who's joining us from wherever you're dialing in today. My name is Faed Hendry, and I do work at an organization called Findhelp Information Services, and we have a number of specialized helplines that essentially help people find help. I want to start off today by acknowledging the work that you do in relationship to fall prevention and awareness, and as part of this community of practice. I think that the work that you do is extremely important and impactful work, and I'm here today not to talk about fall prevention or awareness. I'll leave that to you, the experts, but I'm here today to talk about services, programs, and resources that fall victims, their caregivers, and other healthcare professionals can access on behalf of fall victims. Many of you probably have worked with people who have been a victim of a fall, so I'm going to talk today about important services, programs, and resources that you can access on behalf of the clients that you may be working with. I'm also going to talk a little bit about an unknown resource called the N11 Numbering System. And I'm going to spend some time to hopefully answer any questions that you might have about low-income resources and services throughout Canada. A lot of what I'm going to be talking about today may have an Ontario focus, but I think a lot of the services and programs that we'll be talking about today will be applicable throughout Canada. The first thing I want to talk about is the N11 Numbering System, or the N11 coding system. These are 3-digit telephone numbers that have been assigned by the Canadian Radio and Telecommunications Commission for specific purposes. And I think for many of you, one of the first numbers we all learn growing up is 911. And we all know that 911 is for police, fire, or ambulance. 811 has been assigned by the CRTC for non-urgent healthcare telephone triage service. Now, that's not available in Ontario or Manitoba, but is available in the other provinces of Canada. In Ontario, we have something similar to the 811 number, and that would be Telehealth Ontario, where you have access to a nurse who can assist you with any sort of health-related information that you might require. 711 has been assigned by the CRTC for Bell Message Relay Service for people who are deaf or hard of hearing. 611 is your telephone repair and customer service center, and that could be for Bell, for Rogers, for Fido. 511 is run provincially through the Ministry of Transportation for information on weather and traveler information service. 411 is your local directory assistance. 311 is non-emergency municipal government services. It's not available everywhere in Canada. It's available in about 20 communities throughout Canada, and that's a number that can be called for things like street snow removal, sidewalk or pothole repair, bylaw enforcement, building permits, anything to do with the city or the municipality. In Ontario, it is available in Toronto, Ottawa, Sudbury, Windsor, Halton Region, Peel Region, and Waterloo Region. And the first 311 service started out in Calgary in 2005. And then 211, which is a number that I work for, and one of our helplines, is a number people can call anywhere in Ontario for free and confidential information on social, community, government, and health-related services. Essentially what we try and do is link people up to programs and services that will best address their needs. 211 is live answer. It is available 24 hours a day, 7 days a week, 365 days a year. It is also multilingual. We have staff who speak about 20 to 25 different languages in our contact center, but we also have access to the multilingual interpretation and translation line, where we can get information in up to 170 different languages. People can access information by phone, online, through various websites that we have available, and I am providing you a list of those helpful resources at the end of the presentation, through email, and most recently through text. People can text their postal code to 21166 between the hours of 4 p.m. and 9 p.m. Eastern Standard Time for text information and text response. So if you learn nothing more in this webinar, at least now you're part of the 1% of Canadians that know now about the N11 numbering system. Part of my role is to provide information to our callers, and we answer about 500,000 calls a year in Ontario in regards to the social service system. Most programs that we refer to will have an eligibility criteria. This could be based upon age, it could be based upon income, it could be based upon location, health status, or many other types of eligibility criteria. Most programs will also have an application procedure associated with them. Can they apply in person? Can they apply online? Do they need an appointment? Can they just walk in? Do they need a professional referral? Can they get the service immediately, or is there going to be a waiting list? So this is some of the information that we want to share with our callers and clients. We want to educate our clients to become knowledgeable consumers of the services that we're referring them to. Some of the programs that we'll be talking today may only serve very specific geographical or catchment areas. They might only serve a specific client group. Some may provide different channels of access. Some services that we're going to be talking about today are free. Some might have subsidies attached to them. Some might charge fees based upon a sliding scale. But I am focusing today on low-income services, supports, and resources. I never know how much I did not know about the social and human service system until I started answering questions from clients, because it can be an incredibly complex and humbling experience. It's not easy to navigate the complexities of the social and human service system. And I want to illustrate this through our provincial health program. We all have that in our various provinces, and in Ontario we have the Ontario Health Insurance Plan. And this covers medically necessary services provided by a qualified doctor or stays in a hospital. In some cases it may cover eye exams, but only if you are under the age of 20 or 65, or may have a condition like diabetes where you need to have your eyes examined on an annual basis. Services provided by podiatrists may be partially covered under OHIP. Dental surgery is generally not covered under OHIP unless it's done in a hospital setting. Ambulance services are generally not covered unless you're being transferred from, let's say, a long-term care facility to a hospital, or you're being transferred from one hospital to another hospital. Physiotherapy is generally not covered unless you're a resident of a long-term care facility or have been discharged as an inpatient of a hospital after an overnight stay and require physiotherapy for the condition, illness, or injury for which you were hospitalized. Or if you're on Ontario Works or ODSP in Ontario, you may also be covered, or if you're receiving services through the Community Care Access Center. Mammograms are covered for all women who are between the ages of 50 to 75 years of age, or are between the ages of 30 and 69 and considered to be at high risk. So these are just some of the things that OHIP covers. We could spend the next hour talking about what OHIP covers and what OHIP doesn't cover, but I think it illustrates the complexity of the healthcare system and the OHIP particularly. A lot of the programs I'm going to be talking about now require OHIP coverage. So OHIP is a precursor to receiving a lot of the programs and services that we'll be talking about. A very important program, particularly for people who may have suffered a fall and may need mobility devices, are things, or is a program called the Assistive Devices Program. And this provides financial assistance up to 75% of the cost of over 8,000 pieces of equipment. This equipment includes mobility, visual, communication aids, ostomy and feeding supplies, and respiratory equipment. To qualify for the Assistive Devices Program, you must be a resident of Ontario, have a valid Ontario health card, and have a disability requiring a mobility aid for more than 6 months or longer. Two very important considerations about this Assistive Devices Program are that the device must be approved by an occupational therapist or physiotherapist, registered with the Assistive Devices Program, and you also must purchase that device through an approved assistive devices vendor. And those are all listed under the Ministry of Health website, and I've provided that at the end of the presentation as a helpful online link. The Assistive Devices Program may pay up to 75% of the cost for the following types of equipment: mobility aids, hearing aids, and other hearing devices, communication aids, visual aids such as audio players for reading books, computer-based reading and writing systems. It may also include things like diabetic equipment and supplies, respiratory equipment, home oxygen therapy, and artificial eyes and facial prosthetics. Some of the assistive devices that people need can be incredibly expensive. And even though 75% of the cost is very helpful towards the payment of these assistive devices, people may need to pay the other 25%. There may be some assistance for that, for example, through organizations like the Ontario March of Dimes, the ALS Society, Multiple Sclerosis Society, and sometimes Ontario Works may be able to assist as well.
Hi, Faed. This is Lindsay.
Another program that people may be interested is in a home renovation program. The Ontario Home Renovation Program includes funding for urgent repairs and accessibility modifications for low-income to moderate-income homeowners. People may be eligible for up to $15,000 per unit. This program is not available everywhere in the province of Ontario. It varies from municipality to municipality. For example, currently it is available in Chatham and Kent. They're accepting applications for the home modification program. But currently in Cornwall, they're not accepting applications for this program. It depends upon the availability of funds and how many people have applied to the Ontario Renovates program. The Ontario Renovates program can cover some things like chair and bath lifts, doors and windows, foundations such as roofs, walls, floors, and ceilings, handrails, ramps, installation of ramps, and electrical systems. For information about the Ontario Renovates program, it's best to contact your local or regional office for more information.
Hi, Faed. This is Lindsay.
Hi,
wanted to interrupt. There was a question about the Assistive Devices Program and just sort of the availability of it across Ontario. So apparently there is a long waiting list, and the clinics tend to be located in larger urban centers. Do you have any advice for people who are maybe trying to access this and they're located in more rural areas?
Is it specifically for physiotherapy or just the applying for the assistive device? Just a little...
Physiotherapy.
For physiotherapy, yeah. There is a list, a waiting list, particularly as the participant alluded to, particularly in the smaller, more rural areas. OHIP does not fund all physiotherapy clinics. Some of them are private, which mean that the user would have to pay for that service. There is a list that I've provided at the end of all the OHIP-covered physiotherapy clinics in Ontario, but the participant is right. There is a waiting list, and it varies from clinic to clinic. In more urban areas, it might be more accessible. It might be a little harder in some of the smaller, more rural areas.
Okay. And there was a comment as well from a participant, Bailey. They said that maybe try the CCAC since the ADP authorized clinicians tend to work within the CCAC.
Yeah, that's a very good comment, Bailey. Thank you for that. Physiotherapy can be approved through the community care access centers, and sometimes that is a way to accelerate or improve chances of receiving physiotherapy. It also depends if physiotherapy is being provided on an outpatient basis in an actual facility, or if the physiotherapy can be done in the actual home by the physiotherapist. But one way to access physiotherapy services is through the community care access centers, but they need to be assessed, approved, and then referred for physiotherapy. So thank you for your comment, Bailey. Another program that some people may not know about is the Home and Vehicle Modification Program through the Ontario March of Dimes. It is intended to assist residents of Ontario with a substantial impairment with their disability management by reducing and eliminating safety risks and enabling residents with mobility restrictions to continue living in their home for as long as possible. Again, the amount is up to $15,000, and this is done in conjunction with the Ontario government, but it is administered through the Ontario March of Dimes. Another interesting program that the Ontario March of Dimes has is a program called Designability, and this is where volunteers build custom designed solutions and modifications to help meet the daily needs of people with mobility issues and to maintain their independence. It provides free, barrier-free design consultation at no cost. There is no cost for the consultation. The only charge that is expected by the actual person in need is to pay for the building materials. And for more information on the Designability program, people can contact marchofdimes.ca/designability. I've provided the link there for you. We're going to transition to talk a little bit about vision care and optometry services and eyeglasses. Generally, OHIP will only cover eye exams for children between the ages of 0 to 19 years of age and seniors 65 years of age and over, but they may cover eye examinations for adults between the ages of 20 to 64 years of age if they may require it due to something like diabetes. There are some exceptions for certain medical conditions. A program that a lot of people may not know about is a program called One Sight. It used to be called the Gift of Sight and was run through a lot of optometry services like Lens Crafter or Pearl Vision. And this provides comprehensive eye exams, vision care, and customized prescription glasses to people in need and people who cannot afford their prescription eye glasses. They've been doing this since 1988. It's a global initiative. It's available in 41 countries and is available in different locations throughout Ontario and throughout Canada. And people can call 211 for details on the closest One Sight location. Hearing tests. OHIP ensures diagnostic hearing tests are ordered and performed by qualified physicians. It needs to be ordered and performed and referred by a physician. Third-party requests, such as your employer or the Work Safety and Insurance Board, are not covering hearing tests. They're not being paid by OHIP. OHIP and through the Assistive Devices Program may help to pay up to 75% of the costs of certain hearing aids and FM systems, cochlear implant replacement, and speech processors. Can assist for the purchase of a TTY, a teletypewriter. And they can also get a replacement if the medical condition has changed or the equipment no longer meets the needs of the recipients. In Ontario, we have also a drug benefit program, and this is for individuals over the age of 65 or people who are in receipt of Ontario Works or the Ontario Disability Support Program. Again, people must reside in Ontario for at least 183 days because part of being eligible for the Ontario Drug Benefit Program is having a valid OHIP card. This covers actually over 4,400 drugs that are listed in the Ontario Drug Benefit Formulary. It may include things like allergy shots and the EpiPen. There may be a $100 deductible based upon income. Not all drugs are covered, but there is a program called the Exceptional Access Program, whereby the prescribing physician can apply to this program through the Drug Eligibility Review Branch and ask that a drug that's not normally covered by the Ontario Drug Benefit Program to be covered. So in some cases, that drugs that aren't covered under this program may be covered with a special request of the physician. There's also the Trillium Drug Program, and this is intended for people who have high prescription drug costs in relation to their net household income. It covers drug and nutritional products. It may cover some things that the Ontario Drug Benefit Formulary would not cover. It may cover things like Ensure or Boost or other nutritional products or supplements. There is usually a deductible involved in the Ontario Trillium Drug Program, and that is calculated based upon income and the size of the family. Applications are available online or through any pharmacy. The Trillium Drug Benefit Program year runs from August 1st to August 31st, and reapplication is required. This is the eligibility criteria for the Trillium Drug Benefit Program. Essentially, you may be eligible for it if you're not eligible for other drug coverage, such as the Ontario Drug Benefit Program, or if you don't have private coverage through your work and you have high prescription drug costs in relation to your income. Moving on to dental services. We get a lot of inquiries at 211 about dental services. There is no real free dental services, or in very few exceptions. It is not something that is covered under the Canadian Health Act. In many communities, there may be some low-cost or more affordable options that clients can choose, such as in Toronto. University of Toronto has a dental clinic, as does George Brown. Some public health departments and community health centers in some areas may also provide free or low-cost dental services. Generally, these may be for seniors or children and youth who qualify. OHIP will only cover dental surgery if it's done in a hospital setting. There's also a range of home support services available throughout Canada that are designed to assist seniors and persons with disabilities to maintain their independence in their home for as long as possible. Home support services really refer to a range of services, and it could be something as simple as telephone security checks or a telephone reassurance program, or friendly visiting. It could include things like Meals on Wheels or snow removal or congregate dining. Generally, home support services are provided by both nonprofit and commercial organizations. A lot of them may only serve a very specific catchment or geographic area. So, for example, West Toronto Support Services will only serve residents in the west end of the old city of Toronto. So a lot of them do have a very specific catchment area that they would serve. Some of the services offered by the home support service agencies are free. It could be things like friendly visiting is usually a free service. Telephone reassurance programs are a free service. Some services like Meals on Wheels are not free, but the fees may be calculated on a sliding scale based upon the person's ability to pay for the service. There's also Wheels to Meals or congregate dining. Some seniors or people with mobility issues need to get out of the home into the community to participate in social and recreational activities. There are usually transportation services that can bring people to these services. Or let's say a senior or someone needs transportation to a physiotherapy clinic because they can't use public transportation. Generally, there may be a charge for the transportation services, but it would probably certainly be less than, let's say, a taxi, and they would only be charged for mileage and parking. A lot of the home support service agencies really rely heavily on the use of volunteers. But home support services can be an important component in enabling seniors and persons with disabilities to enable them to remain independent in their home for as long as possible. Many of you and many of the people you may be working with provide care at home. And caregiver support, and we heard yesterday in the budget there is going to be a new EI benefit for caregiver support, which I think is a wonderful decision. Many of us are in the position of providing care to an aging parent, and there are services for caregivers to cope with their responsibilities. This may include self-help. There are many self-help groups where caregivers come together to share their knowledge and information and experiences as caregivers. They may also be programs where they get counseling and support on how to care for someone with, let's say, dementia or Alzheimer's, and they may also be provided with other instructional tools and resources. Primary caregivers sometimes also need a break from the rigors of providing care to a loved one, and there are programs such as respite and vacation care programs where people can plan for a period of time off from their primary caregiving obligations, and this could be based either in the home or through a long-term care facility. There is a charge for respite care services, but some places may charge that on a sliding scale based upon income and ability to pay for the service. I think most people on the call today are very knowledgeable and cognizant about the role of the Community Care Access Centers. They've been around for about 20 years. Essentially what the Community Care Access Program it was an amalgamation of the home care program and placement coordination services, and they still fulfill that role today. So they coordinate admission into long-term care facilities, and they also coordinate in-home health services. So someone may need something like physiotherapy, occupational therapy, speech-language therapy, nursing care. An assessor from a community care access center can come in and do an assessment, and based upon that assessment, put together a plan of care or a plan of support for that person. The amount of home care that people receive that is covered under OHIP is limited. It's not a service that's going to provide 24-hour, around-the-clock care. In some cases, people need more care than can be provided at home, in which case they may consider transitioning into a long-term care facility, such as a nursing home or a home for the aged. And the rates for long-term care facilities are set, and they're regulated through the Ministry of Health and Long-Term Care. And so it doesn't matter, a long-term care facility in Thunder Bay is going to cost the same as a long-term care facility in Windsor. That's going to cost the same as a long-term care facility in Ottawa. And long-term care facilities are for seniors and persons with disabilities who may need assistance with tasks of daily living. There are 14 community care access centers throughout the province of Ontario, and people can call locally their area code 310 CCAC, Community Care Access Center, or go online at 310 CCAC for their local community care access center. In some cases, admission into long-term care facilities, there also might be waiting lists. And that's another learning moment, I think, for many of us, is sometimes just because we can provide information to our clients, it's not a guarantee that they can access the service necessarily in a timely manner or fashion. A couple of other programs that people may need to know about or would like to know about. One of them is the Lifeline program, and this is for people who may be living at home, particularly independently, or they may not have caregiver support on a regular or ongoing basis. The Lifeline program is done through many hospitals in Ontario, and it helps people who are at home who may be at risk of a fall or managing a medical condition or a chronic condition. In case of a fall, it's an easy-to-use emergency personal response system that allows people to summon help at any time of the day or night. Subsidies may be available for this program. I was speaking with the Lifeline coordinator last week at St. Joseph's Hospital, and the fee for this is about $28 to $30 per month. There are other Lifeline programs that are commercial, which may certainly cost a little bit more. Some other programs that people may want to know about, a fairly recent program that started about 2 years ago through the Ontario government was the Ontario Electricity Support Program. And this is a program that lowers electricity bills for low-income households. It's a monthly credit to eligible customers based upon their household income and household size. And the credits are applied directly to eligible customers' hydro bills. Another financial assistance program as it relates to energy assistance or heating assistance is the LEAP program, which is the Low Income Energy Assistance Program. And again, there is an eligibility criteria for this, and it's based upon two factors: how many people live in the house and the combined household income. Low-income applicants can get up to $500 in emergency assistance for your electricity bill. This is actually done differently in different locations. There are literally dozens and dozens of hydro and energy providers throughout the province of Ontario. So, for example, if you're living in Burlington, the administrator of the LEAP program is the Salvation Army. In Collingwood, it's the United Way. In Sudbury, it's the Canadian Red Cross. And in Toronto, it's an organization called NIP, which is the Neighborhood Information Post. And for your local LEAP, Low Income Energy Assistance Program, you can call 211 for a referral. Generally, an example of who would qualify: a home with 4 people and an annual after-tax income of $37,000 would be eligible for a LEAP grant of up to $500 per month for the electricity costs. Again, there's an income assessment made to determine eligibility and how much assistance can be provided. Again, it's not meant to be an ongoing support. Usually it's meant to be a one-time support, or for people who are facing a shut-off notice, who are in arrears of their hydro payments. going to provide just a brief list here of helpful resources. The 211 Toronto website serves the Toronto area, and 211 Ontario serves all of Ontario. That's a searchable website that lists over 60,000 programs and services throughout Ontario. It's searchable by program name. People can search by language. There's also guided searches or featured searches in 16 of the top categories that we have, including healthcare services. So people can search the website in a number of different ways. So if I want a list of all the home support services in Windsor, I can just type home support services in Windsor, and it would give me a list of all the home support services in Windsor. So there's different ways to find and retrieve information. I've also given a link here to the Ontario Assistive Devices Program and the Ontario March of Dimes program. A helpful website that people may not be aware of is something called the Self-Help Resource Center. There are over 500 different self-help groups in Ontario. Many of these services are free. If there is a charge, it's usually a nominal membership charge of maybe $5 to $10 per year. And there are many different types of self-help or mutual aid groups. There are many different caregiver support groups, for example, or cancer survivor support groups. And I've given you a list also through Healthcare at Home, and these are the services provided through the local community care access centers. So those are some lists of helpful services and resources for people. Lindsay, I don't know if there were any sort of questions or comments.
Yes, we did have a few. So on some very different topics, so we'll just sort of work our way backwards, actually. So the first was a comment in relation to the hydro assistance. So in some areas, such as rural Huron East, we fundraise, and the Ministerial Benevolent Fund helps people who need assistance with hydro arrears.
Great.
So just another option for people out there who are looking for information about that. And then also a comment from Brenda about Lifeline. There is a Lifeline medication helper program where a device speaks to clients and alerts them to med past times. I'm assuming like when to take your medication or if you've missed it.
Sure.
She says it's very helpful in the home, and I think it costs about $90 a month to rent. So maybe not completely affordable for people who are on very low incomes, but a very, sounds like, helpful resource.
Thank you, Brenda, for sharing that. And I think that really speaks to a value of a community practice like the fall prevention community of practice, where we're sharing information. I was not aware of that program, Brenda, but thanks to you and thanks to the webinar, now I am. And it's important to really be able to share this information because things are actually changing. One of the challenges of this is that things literally change on a daily basis, so it's imperative to keep our information up to date.
All right, and then a point of clarification here. For the Trillium drug benefit, is that only available to people up to 65 years of age, or is there any age restrictions on this?
No, not the Trillium. Generally, it wouldn't be for someone over 65 because at 65 they would transition off the Trillium drug program onto the Ontario Drug Benefit Program. So the Ontario Drug Benefit Program is for people 65 years of age and over, and people who are in receipt of Ontario Works or the Ontario Disability Support Program. So there's no age restriction, but if you're not usually getting both the Ontario Drug Benefit Program and the Trillium Drug Program because they cover many of the same drugs. So usually it's one or the other. The Trillium Drug Program may be for people who may be working part-time, let's say, or are a low-wage earner who do not have coverage through the workplace, and they have high prescription drug costs in relation to their income.
All right. Thank you so much for clarifying that. So as well, there was a question just to talk sort of broadly about what's covered under the ODSP program, so Ontario Disability.
Okay.
Most of this person's clients are on disability, and specifically she's looking for information about equipment.
Okay. That's a very good question. The Ontario Disability Support Program, people who receive Ontario Disability Support Program are covered with the drug program. They used to get a drug card. Now I believe they all need to show is their OHIP card. That has changed, but they need to demonstrate that they are in receipt of the Ontario Disability Support Program to get drug coverage. There's two parts for both Ontario Disability Support Program and the Ontario Works Program. There are what we refer to as mandatory benefits, and then there are discretionary benefits, which may be up to the discretion of the case worker. Everyone who is on the Ontario Disability Support Program has a worker or a team assigned to him or her. And I think that would be the best place to start. So, for example, let's say someone is on ODSP. For an example, they've had a fall, they need a mobility device such as a walker or a wheelchair. The assistive devices may pay up to 75% of the cost for that, but obviously if you're on social assistance, that other 25% represents a big sum of money that a lot of people just simply cannot afford. So in that case, I would speak to the case worker who in all probability should be able to approve the additional 25% cost for that particular mobility aid, whatever that is. There is a legislation, and the legislation is about 700 pages. It's through the Social Assistance Manual, which sort of dictates what is covered and what is not covered. Some of the benefits, too, could be, a discretionary benefit could be somebody, let's say, who has a respiratory ailment or breathing problems. They may be eligible for an air conditioner for their respiratory ailments, for, let's say, someone who's severe asthmatic. But that's at the discretion of the caseworker or case team. What I try and do with clients is, I think because it's very complex, is try and empower them to certainly, this is how you ask the question. A lot of people, particularly who are receiving Ontario Works or the Ontario Disability Support Program, may not know what they actually are entitled to. So this is where knowledge becomes power, and they should ask their worker, am I eligible for this? Or I've heard from this group that I may be eligible for this. I never promise a client anything that I personally can't deliver because we're not the ones making the decision. But what I try and do is walk them through the process of how to apply for something or how to ask something. And while I'm doing that, I will always rather under-promise and hopefully over-deliver rather than over-deliver and under-promise. This is a part of, I think, managing expectations that is very important. So that's a long answer to a very good question, but I think people should speak to their workers about what they are entitled to, because they are entitled to other things besides the financial compensation and the Ontario Drug Benefit Program. There are other supports that may be available, such things as employment supports. Or if someone has, found a job but needs some adaptive technology in order to do their job, they may be very well entitled to get that support to ensure that they become employable.
Perfect. Thank you. So we do still have some more questions. So just about that Lifeline medication reminder thing. It is called Lifeline Medication Reminders. And we will send a link to that out with the follow-up information to this webinar because a few people have asked for more information about that. So we'll find the link for you and we'll distribute that. And then just a couple of comments from Bailey about just in response to that last question as well. So they said that walkers are usually fully covered by ODSP and ADP. And also bath aids are usually covered by ODSP if a letter of request is sent to the case manager.
Thank you, Bailey. That's good information and good advice.
Yeah, just about some of the specifics, so that's very good. And then a comment from Colleen. This is going back to medication distribution and making that process easier. So she says most pharmacies will package daily meds in blister packs or plastic reusable containers that have the day and time on them. This service is for those who are having problems managing their medications. There usually is no charge for ODB-covered meds if the person is low income. Both the doctor and the patient have to sign off that this extra service is needed, usually for safety reasons.
Great, Colleen. That's very good advice. And there are actually some pharmacies that will even waive sometimes people with prescriptions will need to pay a $2 dispensing fee or a co-payment fee. There are some pharmacies that actually waive that fee as well.
Yes, and actually I was at a conference yesterday and there was a pharmacist there speaking about medication safety, and certain pharmacies will also provide that blister pack service for free. So it's always worth asking at the very least, even if you don't necessarily qualify for it through one of these programs, the pharmacy might just help you out. All right. If there are any questions and people would like to ask over the phone, if that might be easier, I'm just going to put the instructions up here on the screen. So if you would like to ask a question to Faed over the phone, you dial *7 on your telephone keypad, and that will unmute your line. And then just dial *6 when you're done to remute your line.
I do have one question here. I see it's from Shelley, and she's asking where would I be able to find a link to obtain a list of meds covered under the Ontario Drug Benefit Formulary Comparative Drug Index. It is available online, and they do cover close to 4,400 prescription drugs. So I would just do an actual Google search, or the health website I gave you through the Ministry of Health. It's listed on their website. So I would just do what drugs are covered under the Ontario Drug Benefit Formulary Comparative Price Index, Comparative Drug Index. And there's a whole list of there. It's actually quite a large list.
Wonderful. And we can, again, send the link out to that in the follow-up. So any questions, please feel free to hop on the line, dial *7. Questions or comments? And Marguerite did just send the link to the Lifeline medication dispensing service through the chat box. So feel free to click on that if you'd like, but we will send it after as well.
And Brenda just provided the link to the Drug Benefit Formulary. Thank you, Brenda. Thank you, everyone.
There was the question from Colleen about some people qualify for daily dispensing of meds if there is a suicide risk.
Thank you.
All right, so maybe one last chance if there are any final questions. All right. Well, thank you, everyone. I would like to thank our presenter, Faed Hendry, for that fabulous presentation. There was lots of really good, useful information in there, and I think a lot of people will be able to go and refer back to those slides. So we will send the slide deck around after this webinar within the next week or so, along with a recording as well and that supplemental information we promised you. So you'll have access to all of this information to be able to refer back to as you're helping clients in the upcoming weeks, months, and years. So I'd also like to thank all of our participants today for joining us and for your questions. That was a really great discussion, and I think something that people are really eager for information on this topic, and they're eager to help their clients. So it's really nice to be able to provide that information to them. So I ask now that you please just don't close the window just yet. Wait until you've been redirected to the Level 3 lobby screen. Once you see that screen, then it's safe to close the window, and a brief evaluation survey will launch in your web browser. We'd appreciate if you could take a minute or two just to provide us some feedback so we can continue to provide high-quality webinars. For more information about the Fall Prevention Community of Practice, you can visit Loop at fallsloop.com. Loop is a free online communication platform for fall prevention practitioners. So again, that's fallsloop.com. So thank you all and have a wonderful day. We'll see you next time.